Hi, I'm Bill Shergy. I'm at the ACR in Chicago 2018, and I'd just like to talk a little bit about a gout abstract I saw that was quite thought-provoking. It went and told us a great deal about what we already know about gout, or at least thought we knew. And it's nice to have some data about it. It's from the Aucklands in New Zealand, the University of Auckland, and it's abstract number 268. The premise of the study and the title is that changing the name may make a difference. So what is in a name? They did a study of an indigenous population of people who had a high incidence of gout and had a great deal of anxiety and guilt about their disease. And so the effort was made to change the name to crystal arthropathy. And they studied roughly 50 patients in two groups. They filled out questionnaires as they were both diagnosed, one group diagnosed with gout, one group diagnosed with crystal arthropathy. And they evaluated the patients on their feelings of the disease, what they thought affected the disease. Was the disease their fault? Was it diet? Was it heredity? Was it genes? Was it exercise? And as it turned out, it seemed that people with the diagnosis of gout thought it was all diet, they thought it was their fault, and they were less likely to seek medical attention because they were afraid of these things. They were also less compliant with their medications. When we look at patients that were diagnosed with crystal arthritis, these patients thought more of heredity. They viewed it more as a long-term and chronic disease and had a much healthier outlook towards treatment of the disease. Now, I don't know if I'm going to start calling my gout patients crystal arthritis, but I think what it does do is it gives us a further reason to let the patients know this isn't their fault, it's not all diet, it's not that extra beer you had at the ACR. It's genes, and it's a little bit of diet. So with that, thank you, and come to the ACR.